This video is a video for chapter 16 in your textbook, which is entitled Health Technologies. Admittedly, this is a chapter where I do not add a lot of additional material. So the purpose of this video is really just to provide a little bit of discussion and explanation to the material that is covered by the book. And I will be the first to admit that comparative to other chapters, health technologies is a chapter that is not a chapter that necessarily aligns with my own background or even my own research interest. In this sense, this material is rather new for me as well. So the chapter begins by making the really astute observation that humans have always relied on technology in some form to make our lives easier. And when I teach intro sociology and we talk about technology, and it comes up when we are talking about material and non-material forms of culture. And when we talk about material forms of culture, we split that into artifacts and technology. And, since I've been teaching, because technology nowadays is kind of associated with what we think of as technology, our phones, our laptops, our Apple Watches, our Google glasses, that level of technology. But in reality, technology is, just anything that is created to help humans work to and or what this book says helps make our lives easier. And so this would be things that we don't normally think of as technology, like the wheel or the plow, even though those are things that meet the sociological definition of technology. Now, of course, in a health related class in a chapter entitled Health Technologies, there are examples of kind of technology that isn't necessarily cutting edge, where things like, the flushing toilet, the toothbrush, even the stethoscope. All of these are forms of health technology that have helped improve human health by either making sanitation and public health more accessible, more efficient, by making diagnostics, the ability to diagnose disease more efficient, more accurate. Technology does not have to be cutting edge. But certainly, as they note, health technology over time has become more complex. And if you've, had to get any diagnostic tests done recently, you know that to be true. If you've ever had an MRI or a CAT scan, or a mammogram, or even if your dentist, now uses kind of that fancy scanning system. So instead of them actually taking pictures of your mouth for the X-rays, now they kind of put your face inside that machine that kind of just scans and takes all of the X-rays, that way. So it's likely that uh, more and more of us are having experiences with this cutting edge technology. But that doesn't mean that this new technology has totally disrupted how we approach health. And by disrupted, what they mean is disrupted in the same sense that things like Uber really disrupted the taxi industry. And at one point, people really thought Airbnbs were going to disrupt the hotel industry, although it looks like people are kind of, backing off of Airbnb. But disruption just kind of means that the technology comes along and it fundamentally changes how the industry works, to the point where if you are a person who does not adopt the new form of technology, you're almost left behind in the industry. So in that sense, health technology hasn't met that bar. You still go see human doctors, and they have human nurses and human office staff, and there is still this non-technological element that happens in a lot of our healthcare. But that being said, just because it hasn't been this total disruption doesn't mean that these new technologies haven't altered and reconfigured our understandings of health, and our relationships with healthcare professionals. And it is that alteration of social processes and social interactions that really highlights, why we have this chapter in a sociology book, in a sociology course on health. Um, because when the book talks about why is technology a subject for sociology, they really emphasize the fact that technology is a part of social relations. It has an interactive role in human relations. And the theory or the approach that they kind of discuss, that really highlights that, is what they call the co-creationist approach. And that approach, if you're using it to understand technology, is that, science society shapes technology, uh, technology shapes society independent, and then the two components interact with others to shape society. And so that is a quote from Faulkner, um, who your book quotes on page 286. And so he says that, uh, if you understand this co-creationist approach to technology, um, that it doesn't necessarily mean that, the relationship between the two is necessarily equal. Instead, he does note that oftentimes the relationship will be asymmetrical, with, one having more power over the other. um, and and but and this brings us to our theory here, the actor network theory. Even though the relationship is asymmetrical, across different contexts, um, what the actor network theory emphasizes is that doesn't mean that technology has primacy over society slash people, or that society slash people necessarily has primacy over technology. Instead, it really kind of focuses on the interaction between the two. So, the basic premise of the actor network theory is that technology does not appear from nowhere, but must be understood as emerging from within society. But then, once it emerges, society and technology then co create, with technology playing an active role in shaping networks, relationships, and power between humans and technology. So, it's kind of like, once it's been created, not that it takes on a life of its own, but it does have enough power to then somewhat shape, how humans respond to it, how they use it, how it kind of can restructure or change social processes. A key concept in the actor network theory is actants. Actants in A&T can be human, or they can be, a piece of technology or anything that is part of the, network or assemblage. And a key idea of the actor network theory is that no actant has primacy over the other. And so, if a person was using A&T, a person would be interested in learning or studying how health technologies operate as actants, in regards to impacting and being impacted by the people who utilize them. So, and there are studies out there that really do look at that. Certainly, I've read articles about the exact impact that wearable health technologies, so things like Fitbits and Apple Watches, to what extent do they not just measure different, health related statistics, health related, activities. But to what extent by people being aware that they are, monitoring that data, it actually encourages them, influences them to incorporate certain activities in their daily lives. So in that way, the Fitbit, the Apple Watch is actually serving as an actant. It's actually exerting an influence in the wearer's decision, to get their 10,000 steps, to not sit for more than an hour and a half at a time. So in that way, that's what it means when they say, it's not like one has primacy over the other, and the focus really is the interaction between the two. The book goes on to discuss that, especially as health technology, all technology really has a growing presence in our day-to-day lives. They kind of warn researchers, they warn academics not to fall into one of two common traps. One common trap is entitled technological determinism, and that refers to thinking that whatever you're studying is explained or determined by technology. It grants too much power to technology. Without meaning to, I sometimes hear students, fall into that trap themselves. Where they discuss things like anxiety or uh, having bad body image, and or having unrealistic expectations of relationships, and they point the finger at social media. Right, it's the social media, it's the social media. Well, that's what we mean by technological determinism. um, Not to say that social media doesn't have an effect on all three of those things, because there's research that certainly suggests that it does, but it doesn't determine those things. Because if it did, then what we wouldn't have had 20, 30 years ago, before the arrival of Facebook and Instagram and so forth, is, we wouldn't have had anxiety, we wouldn't have had bad, body image, we wouldn't have had unrealistic relationship expectations. And as a person myself who probably, is just at that, Generation X slash millennial cusp, that I can solidly remember my early to mid teen years as, existing before the internet was even really much of a thing. And then can certainly remember going through college, without there really being social media, just for Facebook to kind of, be on the scene. By the time I was in grad school, let me just assure you that all of those things definitely existed before social media. They predated social media, and people were concerned about them then, and they pointed to other things at that time. Some of those things also being technologies, things like, movies or magazines. Um, the rise of Photoshop in magazines in particular. So, technological determinism, you just want to make sure that you aren't granting too much power to technology. It's powerful, but it's not that powerful. But on the other hand, you don't want to engage in social essentialism either, which is really the opposite. It ignores technology as an actant, and it solely focuses on what social agents do, um, with the technology, but it doesn't focus on the properties and the abilities of the technology itself. And you can imagine that for a lot of, maybe older academics, that are certainly academics that maybe are more or less comfortable with technology, it's very easy perhaps to fall into this trap, the social essentialism trap, where you highlight the role of the social actants, you give them primacy over the technological actants, and you just kind of treat them like tools, which for the theory, the actor network theory, that isn't, or the co-creationist approach, that doesn't align with the tenets of that theory and that approach. As your book notes, both of these views are reductionist, and they miss nuance regarding how technology and human social agents actually interact. So then, for the most of the rest of the book, it really then starts to focus on forms of health technologies. And although they begin by reminding you about, actual physical objects, um, things like MRI scanners, mammography machines, even the far less stethoscope. They largely focus and have an extended discussion on digital health technologies. And so, these are the more complex technologies. These are usually the newer modalities. And they provide a typology of these types of technologies on page 290, and things that they kind of emphasize in this list would be things like telemedicine and telehealth, um, digital health promotion, and bio metric tracking, um, digital epidemiology, digital health games. So they emphasize like all the types of health technology that, when combined, when digitized, has impacted. People's approach to their own health, whether it's taking care of their own health, learning more about their own health, communicating with their doctors, communicating with other people about their health. Um, After kind of offering that typology, they then kind of focus on some specific forms of digital health technology in greater detail. The first one that they focus on is the one that they identify as becoming an increasingly common approach in providing healthcare, which is telemedicine. And sometimes it's also referred to as like telehealth or telecare. This is basically, technology that allows people to uh, be able to have a greater independence from healthcare providers and caretakers, because instead of having to physically check in with them and have like face-to-face visits, um, or face-to-face consultations, instead telemedicine, telehealth allows people to have these consultations and even receive diagnoses, and as well as like in some cases like a delivery of a diagnosis remotely via digital technology. At the time they wrote this book, of course, as common as this was becoming for just kind of personal preference reasons or scheduling related reasons, coming out of COVID, um, there is probably a greater likelihood that all of us have now experienced this form of healthcare, just because hospitals, as well as some doctors' offices, were so busy and so limited to see patients outside of COVID care, that for things that were considered non essential, particularly initial consultations, a lot of hospitals and physicians' offices implemented some kind of form of telemedicine, telehealth, telecare, whether it's, like I said, actual visits and consultations that take place via phone, via Zoom, or an increasing number of offices and hospitals even now do like health chat functions, right, where you're like kind of typing out your response to someone. Um, Another kind of aspect that of digital health technology that the authors kind of hold up and emphasize relates to social networking. And so, obviously, social networking, um, Facebook, Instagram, Twitter, it's familiar and it's a part of a lot of people's daily life. But what they're emphasizing is how it has also become a way of disseminating health advice or facilitating interactions between healthcare providers and patients. And they kind of debate, whether or not um, this is ultimately positive or negative. And so, in some ways they feel like it definitely can be positive because it allows people to disseminate positive health messages across the general population. Um, but they also kind of warn that, once again, it isn't just a one-way street. It isn't just a tool that healthcare practitioners can use. It's a tool that lay people can use as well. And once again, we can kind of look to COVID in the same way that folks can use social networking to disseminate healthcare messages. People can also use social media to disseminate healthcare misinformation. Um, and in the same way that healthcare practitioners, clinicians can try to use social networking as a way to, reach out and interact with their patients, to garner new patients or to strengthen patient relationships, people can and do use social networking as a way of, complaining, um, uh, even maybe harassing, certainly evaluating um, their experience with healthcare practitioners and providers. Um, and then kind of the final um, specific form of health technology that they offer a little bit of extended discussion about is what they refer to as like personal health technologies or self-care monitoring packages. So things like Fitbits and Apple Watches. And so, they talk about these types of technologies in terms of their technical capabilities. The fact that, like the Apple Watch can, record and distinguish between mother as well as fetal heartbeats. That's pretty amazing that, they can do something that, a little wearable could do something like that. It really just emphasizes once again, the technological progression we've made in a society. But they talk about these technologies as being sites of what they call micropolitics. And micropolitics is how individuals or organizations can realize their aims or exert their power in a specific defined context. And so basically, they talk about how the micropolitics of personal health technologies, how it plays out depends on, the people who develop the technologies, and the different perspectives they may have in regards to those health technologies. Is it something that's being promoted by a public health organization or a corporation or a patient? If it's something that, people have a negative perspective around, then people may not enthusiastically adopt it. They may see it just as another way of, technology and corporations, monitoring and collecting our private health related data. For some people, that take a more positive perspective on this topic, they may instead kind of perceive it as being increased agency and having increased personal control over some of these measurements in this data, being able to gather that data and interpret it themselves outside of the healthcare office or facility. So, all of this, of course, is just to say that, once again, that it's not straightforward in terms of its positive or negative impact, that you have to consider the relationship between the technological agent, but also the social human agents involved, and making sure to not fall into that trap of technological determinism or social essentialism. And so the end of the chapter is basically just talking about the limits of technology. Even though the authors acknowledge that there is an increasing role of technology in health and medicine. They are pretty doubtful that technology will replace or supersede the human element, meaning they don't think we'll be going to robot doctors and getting, our blood pressure checked by a robot nurse, any time soon. And so, part of that they say is that, based on the data, although there are some occupations that are very high risk of being automated, um, several health related occupations are very low on that list. And maybe it's because, when we're dealing with our health, when we're dealing with something that is potentially as as upsetting or as joyful as our health related diagnoses, you know we the authors seem to suggest that we want to deal with humans, that we are still partially looking for some level of empathy and emotional capacities in the people that hold these occupations, that in some sense is just as important as accuracy or efficiency. And so they talk about that through like the role of caring, and that jobs that involve human action and human interaction and caring, this is part of why they have a low risk of automation. That at least right now, people aren't really developing or working on that type of automation technology, because the assumption is there would be a fairly low demand for it. Um, People want their good news, you're having a baby, which is usually good news for most people, or their bad news, a diagnosis of a terminal illness. They usually feel better if it's coming from an individual, preferably an individual that is empathetic and caring and understanding when they deliver it. And so in this way, although technology will probably continue to help healthcare practitioners do their jobs well and do their jobs with increasing efficiency, or do their jobs across digital context, so that people don't always have to be face to face to receive their knowledge and expertise. What doesn't seem likely at this point, at least in time, is that their jobs themselves will be replaced by this technology. So the chapter concludes with two primary points. First point: technology is a part of society, and humans and technology co create, shape, and reshape each other. So basically, a restatement of that co creationist approach. And then the second point: technology isn't inherently benign or positive, and that research must be done on new technologies to ascertain what about them makes it good. So just because it's new and we see it through this lens of, oh well, this is technological progress, doesn't necessarily mean that it is inherently positive or inherently benign, which basically means harmless. So, the authors are just warning, I guess, technology creators and adopters, to make sure that they approach new technology and consider new technology in a more balanced way. And so, like I said, it's fairly short chapter without much new that I'm going to add here. So that is all for this video.